How do CSF findings differ between MS and other neurological diseases? When discussing how cerebrospinal fluid analysis can help distinguish multiple sclerosis from other neurological diseases, it is essential to understand the unique patterns it reveals. In multiple sclerosis, cerebrospinal fluid typically shows distinct findings. One of the most notable is the presence of oligoclonal bands. These bands of immunoglobulin G are found in about 85 to 95% of patients with multiple sclerosis. Their presence indicates that there is immune activity occurring within the central nervous system. Another key finding in multiple sclerosis is an elevated immunoglobulin G index. This index measures the ratio of immunoglobulin G in the cerebrospinal fluid compared to the serum. An increased index suggests local antibody production, which is often seen in multiple sclerosis. Additionally, cerebrospinal fluid analysis in multiple sclerosis may show mildly elevated white blood cells, typically lymphocytes, indicating inflammation. The total protein level in the cerebrospinal fluid is usually normal or only slightly elevated, which is different from what is seen in many infections or other inflammatory diseases. In contrast, other neurological diseases present different cerebrospinal fluid profiles. For instance, in cases of viral or bacterial meningitis, the cerebrospinal fluid often shows marked pleocytosis, which means a significant increase in white blood cells. This may include neutrophils or lymphocytes, elevated protein levels, and in bacterial infections, decreased glucose levels. Another condition, neuromyelitis optica spectrum disorder, may show pleocytosis and elevated protein in the cerebrospinal fluid but typically lacks oligoclonal bands. Specific antibodies, such as aquaporin for immunoglobulin G, are used for diagnosis in these cases. Similarly, IgG for related neurological disease can mimic multiple sclerosis but will show elevated IgG for levels in the cerebrospinal fluid and serum, which is not characteristic of multiple sclerosis. Other autoimmune or inflammatory diseases can present with varying cerebrospinal fluid findings, but they often do not show the specific oligoclonal band pattern seen in multiple sclerosis. Therefore, the presence of oligoclonal bands and an elevated immunoglobulin G index are hallmark findings that help differentiate multiple sclerosis from many other neurological diseases. It is crucial to interpret cerebrospinal fluid results in the context of clinical symptoms and imaging studies, as some conditions may overlap. Cerebrospinal fluid analysis is just one part of a comprehensive diagnostic approach, which includes magnetic resonance imaging and clinical criteria to accurately diagnose multiple sclerosis and distinguish it from other conditions. Always consult a qualified healthcare professional for a thorough evaluation and diagnosis.